Hello, my name is Bisi Oyarikwa. I'm here with Tomiwa Kovalawale. He's a 13-year-old student and he presented in the clinic with left ankle pain, and we're going to do the examination of the talocrural joint and the ankle joint today. Okay, lie down. Okay, so Tomiwa, I'm going to have you do the active motion. I want you to go into dorsiflexion as far up as you can, both legs. So that's good, equal. Plantar flexion. Good, equal. Okay, now I want you to invert it. Invert. Good. Don't move your knees. Good. And evert. Do you feel any pain in any of these movements? No. Okay, move up a bit. Good. Now I'm going to do the movements in passively. Tell me if you feel any pain. Go into any pain?
No.
Good. Any pain? No. In inversion?
Yes.
Good. Any pain? No. Okay, so Tomiwa presented in the clinic 2 weeks ago with left ankle pain, and he presented a mechanism of injury. He presented it as a misstep when he was going down the stairs, and his leg went into plantar flexion, adduction, and inversion, which would have caused any sprain in the lateral side of the ankle. So we're looking at either the sprain of the anterior tibiofibular ligament, of the calcaneofibular ligament, or the posterior tibiofibular ligament. So we're going to do the tests to find out which one of these ligaments is compromised and to know which treatments to go with. So he did not have any swelling around the ankle joints. No swelling. There was no swelling. There was no ecchymosis. There was no erythema. It was just pain. He presented the pain around here. That was where he pointed to and he presented the pain as intermittent, not constant, and we're looking at a possible sprain of the ATFL ligament, but we'll do the differential diagnosis to know exactly which ligament is sprained. Okay, now I want you to stay in. I'm going to do the anterior tibiofibular ligament stretch test. I'm going to mobilize the leg. The leg will be in flexion to relax the gastrocnemius and the soleus muscles, and I'm going to take the leg into a plantar flexion, adduction, and inversion movement, stressing the anterior tibiofibular ligament. You can see a lot of movement in the area, very displaced, and it feels pain. You can see apprehension. So it feels pain there. So it's positive for the anterior tibial ligament. I'm also going to do this using the anterior drawers test. And with the anterior drawers test, I'm going to stabilize the leg in flexion and grab the calcaneus and move it forward in an anterior translation. So I'm going to go like, you can see the movement that is it's displaced. The translation is quite, you can see the translation, and it feels pain when I do that. It feels pain, a lot of pain around there. So we're looking at possibly a first-degree sprain of the ATFL. But just to rule out the CFL, that's the calcaneofibular ligament and the posterior tibiofibular ligament, I'm going to do the stress test just to rule those out. So for the CFL ligament stress test, I'm going to move it, grabbing the calcaneus and moving it into an adduction and anterior medial translation. And I'm going to go like that. Any pain?
Yes.
It feels a bit of pain there, so there might be a little bit of the CFL ligament affected, and then we'll do the PTFL, that's the posterior tibiofibular ligament, and we'll go with the calcaneus, mortis. Okay, so that's quite firm, and it shows that there's no involvement of the PTFL. So right now we're looking at definitely the ATFL ligament sprain, and possibly the CFL ligament sprain. So in the intervention, we're going to put this into consideration into the interventions that we're going to use to concentrate on the ATFL and the CFL. But right now I want you to stand up because I want to do the proprioception tests, and I want you to stand on one knee, on one leg. I want to see your balance. Wrong leg. That's a good leg. Okay, so let's see how long we can stand there for. 1, 2, 3, 4, 5, 6, 7, 8, 9. Good. Now I want you to try squatting with just one leg. Okay, down, up, slowly. Good. You can see a little bit of shaking, and you can see that the foot goes into pronation. The foot goes into pronation when he's trying to balance on one leg. So we have to do a bit of balance and proprioception exercises there. You see a little bit of shaking of the knees and of the ankles, and you can see the foot is gripping with the left lateral side of his foot. That means his foot is going into pronation. That could be a reason why he's having recurrent. That could be a reason why he's having recurrent ATFL injuries, because he's had 2 sprains in the past 2 weeks. Okay, then you can sit down. He's had 2 sprains in the past 2 weeks. So we're going to start with the rest, ice, compression, and elevation. And we'll also use this to, because the second sprain was just a couple of days ago, so we use this to reduce any inflammation in there and to prolong and enhance healing. And we'll also start with ultrasound. We'll have ultrasound on, and then you'll have a lot of exercises to build up the muscles around there, and also to help balancing and proprioceptive exercises. Thank you.